Hello everybody, I am Dr. Sanjay Gupta. I am a consultant in internal medicine and diabetology. I have a practice of last 20 years. Currently I am in Bangalore. I practice in BN Hospital and in Prima Diagnostics at Shajapur Road. I have also been actually publishing some papers and writing books on diabetes and patient care management. Diabetes, as you know, cannot be treated just alone with blood sugar level titration. Of course, blood sugar level titration is the most important thing to do in diabetes care because you have to titrate your medicines, the oral drugs or insulin or both, and plus you might also have to look at how well you are seeing the trends of the blood sugar levels. But when I say that it is not confined to blood sugar levels, it opens a huge canvas, and that is because you are dealing with comorbidities and diabetes as a syndrome complex. But let's look at what is happening to the patient. Once you know your labs are taken care of, once you know that you are actually taking care of the acute ups and downs of the patient, then you have to go back and win the confidence of the patient that you are actually reaching out to tell them what could be risk and what could be the complications arriving as per the diabetes age and as per the age of the patient. So there are two different things which we talk about today. Now we also say that what are the routine care which we are trying to give them. At the same time, we have to customize the care where we say that okay, it does not apply to every patient because one shoe doesn't fit all. So you might have to see that a certain medicine or a certain insulin may not bring that desired effect, and hence there may be more iterations which you might need with the patient, and hence that becomes more personalized care, and that also becomes more integrated care. Now whether you have told the patient to get an eye checkup done, for example, or if are they careful about what is the type of beta cells they have in terms of the age of the diabetes, and whether at some point in time they will not get the desired effect out of the oral drugs which they are taking and they have to shift to insulin. Have you even advised the patient to be careful with their personal hygiene, take care of the feet, take care of their genitals, or take care of their hydration and take care of their exercises, daily exercises. So there is a certain way of approaching a diabetic patient which is different from, I feel it is different from all other illnesses which we tackle today. And hence I call it a personalized approach towards the diabetes patient, where again we are actually preparing the patient to be more compliant and the patient to be more actually trying to avoid the risks involved. And hence the global diabetes burden today is not just the population of diabetes exploding, it is actually the expenditure of each country which they have to spend on the diabetes as well as diabetic complications. So let's come together to give a personalized diabetes care to the patients.